Suozzi.
Thanks, Mr. Chairman, and the ranking member for holding this hearing today. Really appreciate you bringing attention to this. If you ask the American people what are the issues they're most concerned about today, they say affordability and health care as being two of the top issues that they care about. So the more that we can do to tie this issue into affordability of health care, I think the more attention we can get to this issue. I want to start by thanking the witnesses. I really appreciate you taking the time here today for telling your personal stories. It's a big hassle to come down here to come to this thing. You have to prepare, and the time that you spend, I'm very grateful to you for spending the time. We've heard everybody talk about it today. There's 100,000 people waiting for organs in the United States of America. And every day, as Congresswoman Del Bene just mentioned, 13 people die waiting for organs. And there's these allegations that you've all talked about and other people have written about of abuse that are taking place, that it's costing a lot of money, that it's treating people unfairly. Some really shocking things that we've heard in some of the testimony today about people getting operated on when they're still alive. Scary things that are happening. I made a point of speak to a constituent of mine today who I know is looking for a kidney. She told me she's been waiting 9 years. I mean, I'm going to dig into that further. I mean, how could it take 9 years? I mean, it's just hard to imagine. And I'm also concerned about this issue that we provide incentives and payments for harvesting the organs, but not necessarily the same for actually resulting in a transplant. And I want to just explore that with you a little bit. So my understanding is that there are 54 organ procurement organizations in the United States of America. And some of them do a great job. And some of them are really bad. And part of our hearing today is to try and highlight the ones that are doing a bad job so that we can hold them accountable. We heard about the one, I think, in Miami you talked about earlier that's already been held accountable. And today we've heard a lot about Kentucky and New Jersey. So I just want to get clear. Am I right in what I'm saying that we want to try and get CMS to hold Kentucky and hopefully New Jersey accountable? Ms. Erickson, you seem to be nodding your head. What do you say to that?
Yes, sir. And the way that CMS can hold them accountable is by immediately removing them and replacing them with higher performing OPOs that will do the job with integrity. They can do that anytime.
So some of the OPOs do a good job. They're not all bad.
Yes, sir.
And they're rated by the CMS. And for example, my OPO in my district, I called them up in preparation for this hearing. They had a very bad rating back in 2000, and today they're in some of the higher ratings. And they've dramatically increased the number of organs that they have both harvested and transplanted. So is there anybody else that we should be focusing on other than Kentucky and New Jersey right now? Is there anything that you want to call to our attention?
Yes, sir, absolutely. And we can even look at the CMS data and investigations that have happened across 4 committee investigations. For example, one of the largest OPOs operates in Los Angeles. It has been investigated by your Senate colleagues for harvesting human pancreata as part of fraud schemes. There are other OPOs who have been singled out for self-dealing and conflicts of interest that are also under investigation by your committee, such as Oklahoma. But sir, I think you're right that Kentucky and New Jersey are the 2 where there are just rampant whistleblower accounts that we have to make sure CMS acts on now.
Now, Ms. Erickson has talked a lot about pancreata. My understanding is that 80% of the organs that are sought are for kidneys. Is that accurate? Does anybody know?
Yes, sir.
That is accurate, okay. So we want to just try and bring attention to this issue as much as possible from the stories that you've told, Ms. Knuckles and Ms. Martin and Ms. Erickson, and the data that you've provided with Dr. Gee, to try and hold the bad actors accountable and try and improve the system. Is there anything we can do to incentivize more transplants as opposed to just harvesting of data? Go ahead.
One thing, sir, is we can make sure that there is no such thing as a financial count for kidneys, right? The clinical count is what matters. The clinical count is what saves lives. The financial count, that's Medicare fraud.
So right now, it's my understanding that we spend between $500,000 to $2 million for every single transplant that takes place, from the harvesting to the placing to the transplant. And that's a lot of money that we spend mainly Medicare, I think, but also Medicaid as well. And we have to make sure that the bad actors are held accountable so that this money that's spent is spent in an efficient way that actually makes people's lives better. So the more transparency that you've talked about and shining a light on this issue is a very big help to getting that done. So thank you so much, everybody, for your time again. Mr. Chairman, I yield back.